Hi friends, I'm Diba. Welcome to our Let's Talk Baby. Today we are going to talk about chiropractic care in infants, such a great topic. And we have invited, or I guess you've invited us here, Dr. Kelsie Keene with Keene Family Chiropractics. So thank you so much for taking the time out to come and talk to us about this. We know that there's more and more families turning to chiropractic care, and we know AAP is like, there's more research that needs to be done, but there is good research out there that is showing benefit. So what I really wanted to do is take the fear kind of out of it, talk about the benefits of chiropractic care for infants, talk about the risks, and then also how to find a good practitioner that's safe with your baby. And so all of our moms rave about Dr. Keene, so we had to, we've been, chatting for quite some time now. She's come to our breastfeeding support group to talk to our moms. I couldn't be happier that we have her with us to tell us and to guide us through this today. So Dr. Keene, tell us about your practice.
Been here since 2010. It's very much a family practice. So we see all the way from infants to mom and dad and the grandparents all come here. We specialize in the 5 essentials of health. So most importantly, we start with chiropractic care, but we also have resources and education on nutrition, detoxing, exercise, and increasing oxygenation of our body, and then minimizing toxicity and mindset. That's the 5th one that we go through. So really a healthcare delivery system aimed at helping your body perform optimally based on what our body naturally needs to thrive.
Let's talk about how does chiropractic care different in infants versus the adults?
The reason behind the adjustment is the same for any age group. Our goal is to find misaligned vertebrae that have created interference in the nervous system, and because your nervous system controls everything in the body, that interference, those misalignments can create a host of health issues now or in the future the longer that problem is there. So where most people think about chiropractic care and they think about adults getting their spine cracked, as people say, or popped, when you adjust an infant or a really small child, typically you don't hear any of those kind of noises. There's not the same kind of force that you would use for an adult. It's actually extremely gentle and low force. Most babies will sleep through their adjustments, just to give an idea. The amount of pressure you have to use to really gently align the spine could be about the same amount of pressure that someone could handle if they were putting pressure on their own eyeball. So maybe less than a pound of force gently applied in the right position can help to get that joint moving again and realign it so the body can start to flow of that energy and nerve conduction so the body works correctly.
Wonderful. And to kind of demonstrate that today, we have a special guest who's gonna, we're gonna get to see her get adjusted, so that's gonna be great.
It takes the mystery out of it.
Yes.
I think the thought of a newborn getting adjusted, if you've never experienced that, would be crazy for somebody.
Yes.
Then when you actually see it and you see how gentle it is, and then you see the kind of results that most parents get after those very small, gentle alignments, you understand why so many parents take advantage of that.
Yeah, so I think that's really good that we get to see it too. What is the age limit? Like, is there an age you shouldn't do it on?
So the youngest patient I've ever adjusted was just a couple hours old. So I'm pregnant right now and due in January, and being a chiropractor and understanding the importance of the nervous system functioning optimally, one of the first things I plan on doing is checking my own baby right after the birth process. Intrauterine constraints while you're pregnant, or the force of the birth process itself, especially if there's complications depending on the baby's position, or if the doctor uses forceps or suction, or some normal deliveries have doctors using sometimes up to 30 pounds of pulling force on the baby's head. And those kind of issues within the birth process can create those first misalignments. Usually you will see it up at the very top of the spine. And so the sooner that baby gets checked and adjusted, the better, because they are growing so rapidly right in the beginning of their life, we want that nervous system free of interference so it's working just the best that it can. So
wonderful. So
there really is no age limit.
Wonderful. Oh, I'm excited.
Sooner the better.
Yeah. So I'm interested to hear with your baby what you see, and
I'll video it and share it with you guys.
That'll be great. All right. So what are some common uses for chiropractics in infants?
So it depends on the parents. A lot of people will come in because they're dealing with a particular issue that they want help with, and I would say the most common reason would maybe be constipation with their infant or child, chronic ear infections, colic, general gassiness, or being really under a lot of distress. Sometimes it's for breastfeeding issues. One of the things that we'll often look for that can give us some telltale signs of whether there could be an issue within the neck of the child is mom might notice that the baby feeds really well on one breast, but on the other side they're having a hard time latching, or they're not comfortable, they're not staying on the nipple, and that could all be a result of the baby's very uncomfortable and not able to fully use the range of motion in their neck, and because they're in pain and distress in that position, they don't want to feed. And so those are some of the main reasons I would say that we often see kids. Reflux is another one that is really common. A lot of people come in. There's an area in the middle part of the child's back that controls the muscle at the end of our esophagus, which closes the esophagus to the stomach. And if we have a problem in that part of the spine, and it affects the nerve controlling that muscle that closes the esophagus, the tone of that muscle is not working correctly, and that could be one of the reasons why they're getting those reflux symptoms. So checking the baby and identifying those areas is really important. The other end of that spectrum is that a lot of our parents bring their kids for wellness care. So they may not necessarily have a particular diagnosis or symptom that they're trying to treat that particular symptom. I feel like if you really understand the importance of chiropractic care, a healthy spine, a healthy nervous system, you are addressing any misalignments before it becomes a symptom that we're aware of. That to me is really true healthcare wellness. Yeah, you're avoiding that. A lot of problems I see in adults started when they were kids. So if they could have avoided that 20 or 30 years of problems building in their spine, we would have a lot healthier adults. Our spines would be a lot healthier as adults. And so there's a saying, as the twig bends, so the tree grows. So if you can be proactive with your kids in wellness chiropractic care, you can avoid a lot of those problems too. So
perfect. So there's the wellness spectrum, and then there's when they're coming for specific reasons. I know as a lactation consultant, our moms typically come reflux, colic, or torticollis, or
that's a big one.
Or that pain with positioning. As a nurse, I know too that after birth, there's sometimes babies when they don't want to be on one side versus the other is also from their clavicle or their arm or something like that from coming out of the birth canal.
Even TMJ issues possibly, or issues with the soft palate of their mouth.
Yeah, so many different scenarios and symptoms that babies kind of present with, and so I've heard, the moms who have come have really raved about it and how it's really helped. So that's why I really wanted to talk about it. So wonderful. And so with that, with knowing the benefits, knowing that it could start at any time, are there any adverse effects or things that we need to be looking out for? Any risks?
So in 10 years of practice myself, I've never had any adverse effects with children or infants, pediatric patients getting adjusted. It is considered extremely rare because of how gentle it typically is done. There are different techniques that somebody may use. One of the important things to assess for the safety for the baby is doing a proper evaluation in the beginning. So that might be checking cranial nerves, checking alignment of making sure they don't have hip dysplasia. If you do a particular thing where you're moving their hips, or if there's certain contraindications that baby would not be a candidate for adjustments. Maybe things like atlo-axial instability, where they're missing a ligament or have a tear of a ligament here, or spinal problems like spina bifida, we obviously wouldn't adjust those areas of the spine. So typically patients that I see, or most chiropractors would see, have been checked out by their pediatrician, know if they have any of those contraindications, or we would discover that during their evaluation or their history. So just having a proper history and exam rules out almost all of the scenarios that would create an adverse effect.
Right. I know whenever I was doing my research and reading on the AAP, and they, their studies also have said there's not, that adverse effects are rare. And more studies are coming to show the benefits. So, but it's good to hear from your aspect, what are some things, because we wouldn't even think of, certain conditions that aren't good for chiropractic care for infants. So what would be, there's lots of practitioners out there.
Yeah.
And so I want moms to choose the safest practitioner and the best practitioner for their infant. What would be some recommendations for them to look for of how, what
would be the best fit
for them? Yeah.
So all chiropractors through our education in chiropractic school will have some pediatric training on just pediatric care, how to adjust babies and infants. However, for a lot, they may stop their education there, once they leave school. And in my opinion, it's really important to further your education post-doctorate, especially when it comes to pediatric care, because it is very much a specialty. And if you don't have a lot of experience working with kids, you may not be as comfortable or have as much knowledge. And so you can, anyone could go to icpaforkids.com. It's ICPA, the number 4, and then spelled out kids.com. And that is International Chiropractic Pediatric Association. And so if a doctor is a member or has specific certification through the ICPA, that tells you that they have furthered their training and knowledge in pediatrics. So they're going to be more of a specialist with kids.
Perfect. Wonderful. And so we know that it's a therapy, right? It's typically not a one-time cures-all type thing. So you typically need to come back for multiple sessions. Since we have a breastfeeding audience, for things like reflux or torticollis. So I think those are the two main things that our population comes for. How many adjustments would be needed on average? I know it's different from kid to kid and severity.
Each condition and the severity of the problem you might identify with the baby could dictate what a treatment plan might look like. For example, I know for colic, they've done research showing an improvement in colic 93% of the time within 6 adjustments, to give an example, over typically 2 weeks of treatment. Torticollis is a little more severe, and that might be 12 visits, possibly 6 weeks of treatment to see maximum improvement and normal range of motion in that infant. Reflux is typically, if our sole goal is to see improvement with that reflux symptom, it might be a 6 to 12 visit type of treatment plan. But it really depends, and you're taking assessments of how that infant's doing from visit to visit, and just making sure you're supporting the spine to hold those adjustments. It's not usually a one-time fixes everything. Right. By the time most kids come in, their spine may have a holding pattern to that misalignment, and you're doing such gentle adjustments that you're working on that slowly throughout those weeks of care, possibly.
I think that's just important for moms to know that it's not just a one-time type thing, and you might not see vast improvement from the first visit. However, like anything that's a therapy, it takes some time and it takes visits to do that.
I would say for somebody really just wanting more like wellness care, whether it's to help possibly with the immune system or to keep their kids' spine and nervous system healthy from day one, it could be as little as 1 to 2 times a month, having them get checked and adjusted as needed. And that's kind of what we would typically see for a wellness type of treatment plan.
Perfect. Wonderful.
I always say anything that improves the health of your body is worth staying committed to for your lifetime, whether that's nutrition or exercise and clean water, taking care of your teeth and taking care of your spine. You want to stay committed to those things as long as possible, and you'll have better outcomes.
Gotcha. That's lovely. And so cost of sessions on average, it's probably different, everywhere you are, but
this area around Austin, typically you'll see somewhere between the $30 to $50 range, depending on the particular practitioner. Sometimes they'll have treatment plans that discount it if someone's committed to the whole treatment plan. In our office, we typically charge $32 for pediatric adjustments, and then if we have family plans, so if mom or dad are patients under care, then their kids may have additional discounts. Chiropractic care, even for infants, can be covered by insurance, but it depends on if you're treating a specific condition, and they may cover so many visits. It may not be all the visits that you need, and then different insurance policies could vary how much coverage.
Yep. And do they need a referral from their physician for that?
We don't. Chiropractors are primary care doctors in Texas, and so that means that we can diagnose and treat without a referral. Now, there's very few, but a couple different insurance companies that may have specific policies that you do have to be referred from your particular primary care doctor through your insurance, but those are usually very few.
Okay. Well, wonderful. So check your insurance plan. And see if you have that benefit.
Yep.
Perfect. I think I asked all my questions that I wanted. Anything that you wanted to add?
I think that covers most of it.
Yeah. Do we have any questions?
We don't have any questions.
I heard Evelyn start. She's starting to yell for us.
Introduce our special guest.
Yes, let's introduce our special guest. I'm going to let y'all take the show. Oh,
this is Lauren, everybody. This is Evelyn. She's gonna be 5 weeks old tomorrow, and Lauren has been my patient for at least a couple years now. Right?
I think at least 2 years.
So she was actually my patient before she became pregnant, and then she got prenatal care, chiropractic care throughout her whole pregnancy. And then once Evelyn came into the picture, after she was born, which she had a really awesome birth story, and actually had a very short labor time.
Yes.
Very short labor time.
Under 4 hours.
Which she's smiling for us.
Yeah, she's like, yes.
One of the benefits of prenatal chiropractic care can be improvement in labor times and less episodes of, what's the word I'm looking for? Interventions as a result, an easier time, less painful is what some of the research shows. So she came really quickly, and then within a few days we got her checked and adjusted. When she first came in, we did an evaluation. Lauren was noticing that her chin was kind of stuck in a tucked position, and that's kind of the position that you want the baby in when they're going through the birth canal and being born. But if it's too much, the skull, which is called the occiput, can get slightly stuck in that position, which would make it hard for the baby to be able to extend. You might see that they're really uncomfortable in tummy time because it's painful for them to lift their head. She noticed it when she was feeding the baby, and the baby seemed to have trouble latching because of her inability to do this type of move, right?
Yeah.
And so we really gently adjusted that area. So I'm going to check her today. She just came from a long trip from, where did you guys travel?
We traveled to Branson via car, so 4 days in the car.
So a lot of time in the car seat, which sometimes being in a car seat isn't the most optimal position for a baby spine, especially long term. But you do what you got to do. But sometimes being in those positions for a long time, or how they might be falling asleep in the car seat, can cause slight misalignments. So you're going to see me evaluate and check her spine. It's really gentle. What you'll mostly notice is I'm just moving her body and seeing if there's any joints that aren't moving properly. She might be really relaxed through the whole process, which most are, or sometimes, babies cry when you lay them down to change their diaper, and they're uncomfortable then too. So that's a possibility. So yeah, I'll just kind of walk you through what I'm doing. And we're going to have her start, we'll lay her down here, and I'll just sit at the end of the table. Hi. I'm going to be fussy.
I noticed that she gets a little fussy when it's warm, and that is a bright light.
Yeah.
Hi.
She thought it's not as flattering laying on her back.
So, so I'm gonna start by just gently moving her spine and holding her. She just thinks that I'm massaging her or playing with her. And I feel for each individual vertebrae along her spine and put a little bit of gentle motion into it to see if there's any areas where it's not moving properly. You're pretty relaxed. I'm gonna put you on your tummy for just a second. How's she been doing with tummy time?
She's doing really good. She's lifting her head up a lot. She doesn't like it later on in the day, but now it's usually pretty good. Here we go. She actually flopped over good today.
Already?
I don't know if it's the weight of her head.
So I'm checking the joints at her sacrum here. We'll just put some gentle pressure in there, and I'll maybe move her leg a little to see that they're moving. If we have any misalignments or fixations in the joints here, it can affect their digestion. So sometimes that's a cause of chronic constipation we might see. And I feel a little bit here. So what I'm going to do is just gently put some pressure and hold that, and then you might see a little bit of a tiny thrust to get motion back in that joint. We'll see if she thinks it's uncomfortable. So just hold it. Good. And then I come back and I check and make sure it feels like it's moving. And then I'll check up her spine here. You doing okay, Evelyn? There's a little spot in her upper thoracic area. So when I do this one, I'm going to put her over my knee so she's not so flat on the table. And then I just use my hands, my fingers. I don't even use like my whole hand. And I'll put some specific pressure in that one area. And I'll just hold that. Would you mind handing me my arthrostem? Yep, perfect. So this is a tool we sometimes use. It's called an arthrostem. It's a chiropractic adjusting tool. It makes an impulse in the spine. I can push it really hard and it makes a loud, scary noise, but that all depends on how much force that you use. So with a baby, we're going to use very little force. We can also turn it down here. So if manually I don't feel a lot of change, or it doesn't feel like it adjusted really well, or she seemed uncomfortable, then I can use this in one area. That's it. Yeah, it's like I'm sliding. Just check. Now I'm gonna lay her on her back, and I'm gonna check what I think is the most important part of the spine, which is at the very top of the spine. The atlas is the top bone of the vertebrae, and that's typically where we'll see misalignments on newborns and babies. Research shows somewhere over 90% of normal births will have slight misalignments of this top bone there. And that can interfere with sleep, ear infections later, because it can block the drainage of the eustachian tube. So when I'm checking the neck, we want to make sure that she can easily move her head this way, and that she's comfortable and easy to move her head this way. We're not forcing it, we're just letting her relax into it. And if it's uncomfortable, you'll notice. That's good, you see, Mom? And then I'll gently put a little bit of pressure at her occiput, or the back of her head, and I'm just feeling for an easy glide and make sure it's not stuck up or down. And we're going to do, sometimes you'll notice patterns in people's spines where certain areas tend to always be the problem areas or the misaligned vertebrae. With her, it's primarily been the left side up here at the top. So I'm going to bring her head over towards Mom. Good job. And then I'm going to really gently, with just one finger, put pressure right there at the atlas. And just hold it. And we just talk to her. And sometimes if Mom puts your hand like on her chest, oh, bless you, that helps her just go, okay, I can relax. And then we just make sure she can move easy. You did it. Good job. We'll sit you up.
She's like, this is my first adjustment without brothers.
Usually she's got brothers all over her gut. And that's it. Good job. High five.
That was so great.
Do her belly button.
So I think we learned so much today, and to get to see that and the gentleness of it, it was wonderful. Dr. Keene with Keene Family Chiropractics. And thank you, Lauren and Evelyn. We love y'all. All right, until next time, we'll see you later.
Thank you.
Bye.